Pioneer, visionary, crusader, healer. Dr. A. Richard Grossman is a true humanitarian who has dedicated his professional life to the treatment of some of the most defenseless in our society, those who have suffered severe burn injury. A successful plastic and reconstruction surgeon, it was a tragedy that prompted Dr. Richard Grossman to focus his medical talents on the practice of burn care. In 1958, a catastrophic fire swept through a parochial elementary school in Chicago, killing 93 children and 4 nuns. Dr. Richard Grossman was serving his residency at Cook County Hospital in Chicago at the time, and he was the physician in charge on the day of the fire. Many of the children were so badly burned that it was impossible to tell whether they were girls or boys. It was an experience that would have a profound effect on the young chief emergency room resident. When Dr. Richard Grossman moved to Los Angeles in 1964 to begin his aesthetic surgical practice, he began campaigning for a local burn center. He convinced the Sherman Oaks Community Hospital to devote 2 beds exclusively to burn care, and in 1970, the burn center was created. By 1978, the burn center at Sherman Oaks Hospital had expanded into a freestanding 30-bed specialty unit. Through Dr. Grossman's determination and hard work, it has now become the largest burn unit west of the Mississippi. Dedicated to developing and refining new techniques in burn care, Dr. Richard Grossman has been a pioneer of innovative treatments in his field. These include the development of IFP, an instant photographic technique which allows burn doctors to more accurately diagnose and treat the severity of burn injuries. Research into laboratory-grown skin, and the use of high-pressure oxygen chambers to speed the healing process and minimize scarring. These medical successes and Dr. Richard Grossman's reputation for compassionate care have made his name known the world over. During the Yom Kippur War of 1973, the Ministry of Health from the State of Israel called Dr. Grossman to assist them in creating the first burn center at the Tel Hashemir Hospital in Tel Aviv. His career has been dedicated not to just saving lives, but also to saving the quality of life for all of his patients. In 1985, Dr. Richard Grossman co-founded the Children's Burn Foundation with actor McLean Stevenson. McLean himself had been burned as a 6-year-old child, and a fateful meeting with another severely burned 6-year-old boy named Douglas Roy prompted him to try to help. McLean approached Dr. Richard Grossman about reconstruction surgery for the child. Out of their mutual passion for helping young burn survivors, the Children's Burn Foundation was born. This vital organization addresses the special medical, psychological, physical, and social needs of children who have suffered severe burn injuries, regardless of their ability to pay. To combat the silent epidemic of child burn abuse, Dr. Grossman was also instrumental in helping the foundation to develop the SCAN program. This team of professionals is trained to recognize the warning signs and intervene when child abuse or neglect are the suspected cause of children's burn injuries. The work of the Children's Burn Foundation reflects Dr. Grossman's philosophy of treating the whole person, not just the injury. In this spirit, Dr. and Mrs. Grossman host a camp at their home where young burn survivors can enjoy outdoor activities with their peers. Out of the ashes of tragedy, Dr. Richard Grossman's committed leadership has improved the lives of so many in our community. Rosie Garcia, a 14-year-old La Puente girl who suffered life-threatening burns when her family's motorhome exploded. After 9 operations and only 6 weeks recuperation, Rosie walked out of the burn center. Or Dennis, a 9-year-old Russian boy whose scarring limited his facial expressions and the use of his hands. After 2 years of loving care with Dr. Richard Grossman, Dennis can now look forward to the everyday activities of any 13-year-old. Or Bill Jensen, a 28-year veteran of the Los Angeles Fire Department who suffered 3rd-degree burns to 70% of his body. After 16 major surgeries and 117 blood transfusions, the grateful firefighter left the hospital to a hero's welcome. Bill Jensen is just one of the many community firefighters who have benefited from the skilled dedication of Dr. Richard Grossman. To honor this work, Dr. Grossman was named Honorary Fire Chief for the City of Los Angeles in 1994 and inducted into the Firefighters Hall of Fame by the California Department of Firefighters. As the Grossman Burn Center at Sherman Oaks Hospital enters its 4th decade, Dr. Richard Grossman continues his important work. Dr. Grossman's patients come from every sector of the community and every country of the world. His work not only rebuilds lives, but also builds bridges and creates understanding among people of different backgrounds. He's a respected leader and a tireless public servant whose spirit and energy have touched so many in our community. His life work is a celebration of hope.
Tell Robert that I will try to help him, and in the course of that, we will become very good friends.